Good evening, this is All India Radio Kohima and I am Nobin Pradhan with the evening news. The headlines. Prime Minister Narendra Modi says the new education policy will transform job seekers into job creators. Centre asks all states and union territories to allow smartphones and tablet devices for hospitalized COVID-19 patients. Nagaland's COVID-19 tally climbs up to 1,935 and partial lockdown in Dimapur will begin from tomorrow. Now the news in detail. Prime Minister Narendra Modi has said that the new education policy NEP will transform job seekers into job creators. Addressing the Smart India Hackathon 2020, he said the NEP is not just a policy but a compilation of aspirations of all the Indians. Modi gave a mantra to the students and said, "Never stop three things in life: learning, questioning and solving." The Prime Minister said that the time has come for increased focus on learning, research and innovation in the field of education. The Prime Minister said we are focusing on the quality of education in the country. Elaborating on the centre's attempts to transform the content and method of imparting education in the country, Modi said the new education policy emphasizes on interdisciplinary study, which will ensure that the focus is on what the students want to learn instead of being compelled to learn. Prime Minister Modi also interacted with students and inquired about their projects ranging from women's hygiene products to crime detection technologies to water harvesting. This year, over 4.5 lakh entries were received for the competition and 10,000 students are participating in the hackathon. The central government has written to all states and union territories asking that smartphones and tablet devices should be allowed for hospitalized COVID-19 patients so that they can interact with family and friends through video conferencing. It will provide them psychological support. Though mobile phones are allowed in hospital wards, the letter was issued following some representation from the kin of patients alleging that mobile phones are not being allowed by the hospital administration. In the letter to the Principal Secretaries of Health and Medical Education of states and union territories, Director General of Health Services in the Health Ministry, Dr. Rajiv Garg, said appropriate protocols for disinfecting devices and allotting time slots can be developed by the hospital concerned to facilitate contact between patients and their family. He stressed that administrative and medical teams should be responsive to the psychological needs of patients admitted in COVID-19 wards and ICUs. The COVID-19 tally continues to increase in Nagaland as 104 new cases were reported today out of 383 samples tested. Health and Family Welfare Minister S. Pangnupom in a tweet this evening said 62 cases are from Dimapur, 18 from Zunheboto, 17 from Kohima, 5 from Wokha and 1 each in Mon and Pheg. He also said all contact tracing are fully activated for everyone's safety. Meanwhile, 8 more have recovered today from Kohima. The state has now a total of 1,935 cases, out of which 1,279 are active, while 648 have recovered. So far, 4 people have succumbed to COVID-19. Deputy Commissioner Mon Thawasilan K has notified that the total lockdown which was imposed in Mon Town and Tizit subdivision and Ponching subdivision has been extended for another 7 days from tomorrow till 9th of this month. In view of this, the DC has issued certain guidelines. Movement of public shall remain strictly prohibited except on medical emergencies. All business and commercial establishments, shops shall remain closed. Movement of private vehicles except those permitted is banned. All social, cultural, religious, academic gathering shall be banned. A register containing the names and contact details of all those who attend must be mandatorily maintained and submitted to the concerned subdivision officers. No movement will be permitted in or out of Mon Sadar and Tizit subdivision. Any person found violating this order will be penalized under relevant provisions of the law. District Task Force DTF Zunheboto has decided that district travellers coming into Zunheboto should compulsorily produce medical fitness certificate with movement permit from the authorities of the concerned districts, and those travelling without proper documents shall not be allowed to enter the district. In an order, the Deputy Commissioner and Chairman DTF Peter Lichamo notified that those coming in from other districts to Zunheboto district shall remain under home quarantine isolation for a period of 7 days. He also notified that total lockdown in district shall be imposed on every Wednesday and Friday, and shop timings in other days will be from 7 a.m. to 4 p.m. Proper wearing of face masks and maintenance of social distancing shall continue. Defaulters shall be penalized as per the standing order. This news comes to you from All India Radio, Kohima. Partial lockdown in Dimapur will begin from tomorrow after the total lockdown being enforced ends today. The district shops selling essential items and vegetables only would be allowed to open for the public from 9 a.m. to 2 p.m., while wholesale markets would be allowed to open from 5 a.m. to 9 9 a.m. Pharmacies will be allowed to open as usual. Odd-even system of vehicular movement would continue to be enforced, while movement of public would be restricted except those coming out for availing essential commodities. The Assam government has allowed malls, hotels and restaurants to operate following strict COVID-19 norms. In an order, the Chief Secretary of the state said that malls and gymnasiums are allowed to operate from Monday to Friday. The order further said that restaurants, hotels and other hospitality services are allowed to operate on all days except Saturday and Sunday with strict maintenance of COVID-19 protocols. Inter-district movement of people would be allowed on Monday and Tuesday. Non-contact sports in open spaces are also allowed in the state. This order would come into force at 7 p.m. tonight and will remain valid till 14th of this month. Home Minister Amit Shah has tested positive for coronavirus. In a tweet, Shah said his health is fine, but he is getting admitted to a hospital on the advice of doctors. He said he got tested after developing symptoms of COVID-19. The Home Minister requested the people who came in contact with him to self-isolate. The first ever special program on Sanskrit to mark World Sanskrit Day will be broadcast by All India Radio tomorrow. A 20-minute program titled Bahujan Bhasha Sanskrit Bhasha will be broadcast at 7:10 a.m. tomorrow on 100.1 FM AIR News Live 24/7 FM channel. The live streaming will be available on www.newsonair.com, on Twitter at @Air News, News on Air app and News on Air official YouTube channel at the same time. Highlights from the films Priya Manasam and Punya Koti in Sanskrit and interviews with the editors of the world's only Sanskrit daily newspaper Sudharma are being among the major attractions. Union Education Minister Dr. Ramesh Pokhriyal Nishank, in a special message in Sanskrit, underlined the importance of Sanskrit language. The special edition by All India Radio is expected to give a fillip to the outreach of Sanskrit language among the people. And to end the news, a reminder of the headlines. Prime Minister Narendra Modi says the new education policy will transform job seekers into job creators. Centre asks all states and union territories to allow smartphones and tablet devices for hospitalized COVID-19 patients. Nagaland's COVID-19 tally climbs up to 1,935 and partial lockdown in Dimapur will begin from tomorrow. And that's all we have in this evening news. Good night.